Welcome to Planetary Health First, Mars Next, and we have Dr. Russell Robbins, and he is the Chief Medical Officer at Purple Labs, and he is really not only doing amazing things, but a good friend. I've had him on prior, and it's so awesome to stumble across. VIVE is such a community, and we stumbled across each other, and I just was so glad to get you in the studio today.
No, I'm so glad to be here too, Michael. Thank you.
Yeah. So we were going to start talking a little bit about what you guys are doing with clinical trials and how you guys are helping. Tell us a little bit about that.
Yeah, no, absolutely. So at Purple Lab, we have developed our Health Nexus platform. So we gather medical claims, pharmacy claims, and then we link that through our partnership with Datavant, and we create the tokens so we can match social determinant of health information, which we then link to each individual physician, each individual hospital, as well as to the pharmacy claims themselves. We then disaggregate that piece of data, so what we're left behind is for any given physician or medication in the country, we can see what are the demographics behind that. Is age, race, religion, ethnicity, income, job, so we can do much deeper analysis into the claims.
And so what was happening? You're a clinician, you're a physician prior life. What was happening before this in your past life?
Yeah, so prior to this, when I would be in practice, if somebody were come to me and say, what does your practice look like? I would have no way of knowing. And now with the FDA, with their new requirements for having more diversity and inclusion in clinical trials, right now there is no good data source to help identify those physicians. So, we know from the past that about 85% of participants in clinical trials are white, and what we want to do is have more diversity in the clinical trials. Well, there's no easy way right now without the data and without making it actionable to understand where are the right doctors? Where do you go to start recruiting physicians? And even if they don't want to participate, how do you then recruit their patients into some of these clinical trials?
So you guys have really moved fast. I remember I was talking to you a few years ago, and you'd just come on, and then earlier today we were talking a little bit about the conference you just attended, and you have some really great partners in this. Can you tell me a little bit about how that's working and tell me about that?
Oh, absolutely. So when a few weeks ago I was at the Scope conference presenting this topic with people from Paracel, and what we were talking about is, right now if all you are using is census data, you can understand a little bit about what the composition of a population looks like, but you have no way of knowing who the right physicians are. And so it's really, how do you take data such as we have, how do you take their need to enroll physicians into clinical trials and to recruit the patients, how do you tie those two things together? And that's really, what we were discussing at the conference.
Cool. Awesome. Well, this is so good that we were able to have you on today. We're kind of in the middle of moving forward with some new series, one of which is Bring a Friend, Reimagine Healthcare Together. And I think this is just a deep discussion. Is there a friend or someone out there, a colleague or a partner that you're working with that you'd love to go deeper on this topic?
Oh, absolutely. I mean, obviously everybody at Purple Lab would be happy to talk, much deeper on this topic. I could spend a lot longer doing that myself. Our colleagues and partners at Paracel, who are doing this work on a daily basis and are using our data to make this type of work actionable. The pharmaceutical companies that are relying on this type of data to, help them get the clinical trials started. Any of them would be wonderful to have a further conversation with.
Well, great. This has been a great time. I really appreciate you coming on, Russ, and really appreciate it that we were able to have this great discussion.
Yes, thank you so much, Michael. I really appreciate it too.